everyone, on this episode of Coding with Kate, I thought I would talk about how work is going and give you a nice work update because it's been, I think I'm in the 5th month of working at the hospital, like the 5th into the 6th month anyway, and I wanted you all to know how it's going, what I'm doing, what's going on with medical coding in me, etc. So, within medical records, I have accomplished a lot in a short amount of time. I feel like my training has gone by pretty quickly and I progressed pretty quickly. So the things that I have done so far is I've learned all of the rounds, first shift rounds, meaning going to both the inpatient areas of the hospital and also the outpatient area of the hospital to pick up hard copy records that need to be scanned into Epic. I have learned a lot more within Epic, so how to scan in advanced directives like power of attorney, durable will, guardianship, activation of power of attorney, etc., that sort of stuff. Also within Epic, for some documents that need to be scanned directly into Epic instead of using what we call on-base, which is for high volume of documents. So the stuff that goes on to Epic, which is more diagnostic, you scan it in directly into the order or to the encounter, etc. I've learned a lot more about that. I'm pretty proficient in it, thankfully. So go me. There was a time where I thought I was doing it wrong, but I found out I was just doing a shortcut, and then I was doing it right. So I've become pretty good with Epic. I am much more comfortable on phones. I was not happy about phone stuff before, but now that I've done it, it's really not that hard. It's just the weird oddball calls that we get every once in a blue moon that throw me off. But doing phones on first shift during the week or on weekends, we rarely get calls. A lot of it is just the getting the Care Everywhere ID, which is for other hospitals that are not within our hospital network that also use Epic. If they have a patient who has records with our facility, they can get a one-time ID access to that patient's record, and specifically certain records. They don't get all of the information, but they can go onto their Epic program and gain direct access to some of the documents that they need. So they have to call us to get that. So that is majority of the phone calls that I usually get if I'm on phones. And then also with release of information, that's another thing that happens on phones, and I'm much more comfortable with that. So our facility is open, our medical records department in our facility is open 24/7, 7 days a week, 365 days a year. And when it is after hours, so after 5 or 6 p.m. on weekdays and then all day weekends, other hospitals can request release of information of a patient that has records with us for continuing of care emergency issues. So if they have a patient there in their ER and they need specific documents on whatever, they can do release of information. We can release those right away, fax them off to them ASAP. And that is one of the things that I was not comfortable with because the process is a little confusing. But now that I'm doing it, it's pretty easy, and thankfully I'm getting better at it. And there's still a lot with a release of information that I'm still unsure about. Some of the policies when it comes to psychiatric or alcohol and drug abuse, that sort of stuff, but we don't get a lot of release of information when I'm working on the weekends, so it hasn't been anything weird. It's been pretty easy. They're usually requesting like 3 specific documents or documents from a specific encounter, so thankfully that's been pretty easy. Then I moved on to learning about Purge. That is a extra project that can be done at any time. We take our old or older records and we move them to microfilm, which go in our external storage. And those, so far from what I've seen, date back to the 70s. maybe roughly around there. And every year we get a new list of patient accounts or slides of film from that patient that need to be pulled out and purged because they haven't been in I think it's about 10, 15 years. And it is a really good task when you aren't trained on a lot of other stuff. So when I'm on phones or on the weekend, when I've run out of things to do that deal with doing rounds and whatnot, I need something else to do to fill my time because I'm not trained on anything else, any higher up level stuff. So purge is something I can easily do, super simple. We won't go into that whole process, but I find it a lot of fun, and I like being up in external storage. It's pretty great. And then the last thing that I was just trained on, we just finished, was test center. So at our hospital, we have a department, and I think almost all hospitals have their own department for this, I believe. Pre-admission test center. So if patients are scheduled for a day surgery or a surgery that's coming up pretty soon, they have certain tests and procedures that they need to go through, either an ECG, blood work, stress tests, things like that. They need to do those before they can have clearance to do the surgery. So pre-admission test center deals with that, and we get those documents faxed to us, and from there we need to go into that patient's chart, find the specific encounter for the procedure, and scan all those documents directly to that encounter. So then the doctors, surgeons, physicians, etc. can go to that encounter and see all of those pre-admission tests to make sure everything is okay, and then also for the consent to the procedure and any H&P, so history and physical, and any progress notes that say they are cleared for this surgery. They need all of that, and it's all in one place. So that is what I've been doing. Again, that's much easier because I already have pretty good knowledge of how to use Epic, so that made learning Test Center pretty easy. So other than that, that's a pretty good chunk of what entry-level health information clerks or medical records clerks do, at least at my facility. There's a ton more other stuff that I will be trained on way in the future, and a lot of it is very complicated. You need a very high proficiency in Epic to do it, so I'm not even close to even doing that. And another thing that is happening is I am applying for a coding position at a different hospital outside of my current hospital's network, and I only am doing that because my current hospital doesn't have any coding positions open, and I might as well apply whenever a coding position opens up at any of the hospitals in my area. Whether I get it or not, who knows, but it's good to just send out your resume anyway. And in my cover letter and in the resume, I do say that I am planning on doing the exam within so many months. I'm about to update it today to say that I already have my exam scheduled. So we'll see what happens. The current position that I'm applying for, the status has been active for the last 2 weeks, so they haven't thrown out my resume yet. So who knows what's going to happen with that. It's an entry-level coding position, Coder 1, that's entry-level. So we'll see what happens, you never know. But I'm going to continue to apply for Coder 1 positions even if I don't get this current one. I'm going to continue to do it. And I'm also going to let my current employer know that I received my certification if that does happen, so then my profile will be updated for when they have positions available. We'll see. I think that's it as far as how work is going. As far as certification goes, I am continually working on a video documenting this process of applying, scheduling, and taking the certification exam. So keep an eye out for that. The last week of February, roughly, is when that will be completed. because I have scheduled my certification exam for Wednesday, February 21st. So that is when I will actually be sitting for the exam and hopefully getting certified. But that video that will be documenting all of that will be coming out just after the certification exam. And then you'll get to see that whole process. And up until then, I will be posting videos on prepping for the exam, whether it's what you need the day of the exam, what you should be doing to prep for it as far as practicing coding, etc. I'll have videos like that. So anyone who is getting ready to take the exam or is planning on applying to take the exam, they can watch these videos and have a bit of a tutorial or tips to help them with that process. So you'll get some really good information until then. I think that's it. So a lot has happened in 5-6 months, and I'm really excited. So you can subscribe to this channel if you want more information on medical coding, specifically ICD-10-CM, ICD-10-PCS, and CPT, and then other topics within medical coding whenever I get around to doing those. You'll get notifications on all the videos that I post, so you're always in the know. You can comment below if you have any questions on what my job is like, or if you want me to go into more detail on some of the stuff that I do. Of course, I won't be able to give specific examples because I don't want to breach any HIPAA laws, etc. But I will do my best, and I will not be ever saying my hospital name, so I have to keep it as generic as possible. Keep that in mind when you ask certain questions. And then you can also comment any ideas for any videos you'd like me to do, or any coding questions in general. If I don't know the answer, I will send it off to other coders and see if they have any ideas or answers to those questions. And you can like this video if you enjoyed hearing about the update of how my job is going and what a health information clerk does in a very general sense. Please hit like so I know you enjoyed the video. And I'll see y'all later. Bye!